New Mexico Cancer Center and Health Specialist of New Mexico are the proud sponsor of health and wellness on New Mexico Living.
At the New Mexico Cancer Center in Albuquerque, groundbreaking treatments and compassionate care are changing lives for men facing prostate cancer. In this segment, we'll take you inside their state-of-the-art facility where expert physicians are offering personalized, cutting-edge solutions for every stage of their journey. Today, we're joined by Dr. Franklin, a radiation oncologist at the New Mexico Cancer Center, to discuss the various treatment options patients have when facing a prostate cancer diagnosis.
When a patient comes to see me for radiation treatments, they've already been diagnosed with cancer. And typically that's involving a PSA, a biopsy that was done by a urologist, and they typically do MRI-guided biopsies. We talk about all aspects of their care, things that relate to how functional they are, things that relate to their medicines that they're taking, their comorbidities, like if they have had heart disease or diabetes or something like that. All of that might affect our treatments in some way. So when they come to see me, one of the first things that we do is we stage the patient. But at the end of the day, you know, they're either a stage 1 to a stage 4, which is metastatic disease, stage 4. But in terms of localized disease, that's typically a stage 1 or stage 3, or we risk stratify them in a similar way with either favorable up to high-risk patients. Then we have our discussion about treatment options, and they are, for localized prostate cancer, they're typically candidates for surgery, but they also may very well be candidates for radiation, and that typically is things of external beam radiation, which is frequently done around the country. We have state-of-the-art machines. They're called true beams here. What they allow us to do is very precisely target the prostate and the lymph node areas if necessary. And in order to help that targeting and that precision of our treatments, we do a couple of things. So one, we use MRI to help treatment plan our patients. We use markers, seed markers, that allow us to precisely every day target that prostate using these MRI-compatible markers. And in addition, we may place a biodegradable spacer between the rectum and the prostate. And that allows the high doses of radiation to not fall into the rectum area and focus on the prostate. So those are typically things that we do here, and the treatment length is either 5 treatments of very high dose radiation or 28 treatments, which is every day for about 5.5 weeks. Gone are the days when we were doing this for 9 weeks. We don't do that anymore. We're a very cutting edge center. We try to have the latest technologies, the latest clinical trials that really bring, let's say, discoveries that are being worked on through companies or other institutions here into our institution, and to provide the New Mexicans with as state-of-the-art treatment as they can get pretty much anywhere else in the country.